Hi, my name is Claudine Lewis. I'm a respiratory therapy student at Southeast Community College in Lincoln, Nebraska, and I'm here to go over some oxygen tanks and delivery devices with y'all. So first off, I have my oxygen cylinder here. This is an E-cylinder. Um, this is a grab and go, so I don't have to worry quite as much about the neck being broke off and then this becoming a missile because it's mounted in there pretty securely and safely. Always want to transport it in a cart. I know it's oxygen because it's green and it says oxygen. Um, it's not really flammable by itself, but it will definitely feed a fire. I've got all my DOT markings on here. Here's my large diameter safety system, DISS. Here's the small one, or the American Standard Safety System. And over here, I have my little tiny, I don't need a Christmas tree with this one, it's built in. I won't need to worry about cracking the cylinder and clearing any debris or anything because it is already sealed and already on here. Always want to keep it secure so it can't possibly fall over and become a projectile. That's one way to get oxygen. Another way to receive oxygen is with a flow meter. And we'll come over here to this, and it just pops in. I know it's oxygen because it's green and it matches the wall. There's no way I can put this in the air. It won't fit and stay. It's one of the safety systems. I have my Christmas tree to hook up any devices, which is not really necessary on this one. It's got a way to turn it so I can go to the larger system for like a vent, or a smaller system for any kind of other delivery device. It's got the little ball on here, and this one goes up to 15. You can probably hear it. All the way down, crank up. And when I include it, the ball drops. I know it's compensated. Compensated, not uncompensated. I didn't say that very clearly. Some other things about oxygen is you want to make sure your patient doesn't smoke around it. Believe it or not, I've heard of instances where static electricity and the O2 tubing have started a fire in the patient's airway. Also, petroleum products, makeup has some petroleum in it, so if you got a lady who's really worried about how she looks, might have to think of a different way to do that, like not wear makeup. Anyway, so we'll start off with a simple one. We have a nasal cannula. This goes 2 to 6 liters a minute, or sorry, 0.25, a quarter of a liter, all the way up to 6 liters a minute. It comes in infant, pediatric, and adult sizes. So it's kind of curved, so it'll fit in your nose nicely. I have seen them put in backwards, of course. When it's fit kind of snug, a lot of sensitivity can happen behind the ears, especially if someone has to wear it for years and years and years, and kind of under the chin. It'll dry out the mucosa. Definitely want to humidify that if possible. Heating is not really so much of an issue. So you want to get it on here nice and snug. And I'm going to pick, I can hear it running, 2 liters a minute. That's a nice number that a lot of people are at for maintenance. My gauge says I'm in the green at 2,000. So to know how long this would last me, say I was transporting a patient for an x-ray or some other kind of test. Let's see. So I would subtract 500, 15,000 times points for the 0.28 for the tank factor. That's the word I'm looking for. Divided by 4, that'll give me 105 minutes. So 1.75 hours. So I should be able to get them an x-ray and back up to their room without a problem. So next, we have a simple mask. This one has a minimum flow of 5 liters a minute. If any of this touches the floor, you can't use it on your patient. The floor is always a dirty place, especially in a hospital. So there's no bag on this. It's just a simple mask. It's really handy to use if someone isn't tolerating the cannula, if they're more of a mouth breather, then so it's much more effective. It's also easier to use on infants and children. You can kind of hold it there as opposed to strapping on their little heads. So minimum 5. You don't want to breathe in it with no air hooked up because you're kind of breathing your own carbon dioxide. So we'll go up to 5. Yep, it's a 6. Went from 4 to 6. And it adjusts right here and at the nose so you can get a nicer fit. Everybody's face is shaped a little bit differently. Simple mask. Let's do the non-rebreather. We have a non-rebreather mask. Minimum flow on this is 10. So you want 10. Most people say 10 to 15. And I don't know how I keep knotting these up. It's fantastic. So oh, my bag inflated this time. That's nice. So it's got valves on here to keep me from rebreathing the CO2 that I'm exhaling. Holds very nicely. Let's say a patient started off on this after a motor vehicle accident, and then after all of their tests and labs and stuff, their O2 sats are like 98% on this. If they were on 15, we'd probably drop them back to 10, test them again, and then if they're still doing 98% on 10, probably drop them down to a cannula and then slowly wean them off, depending on what else was going on with them. So here's Venturi. This is, ooh, it almost hit the floor. This is Venturi. It is the most accurate way to deliver FiO2. You can do anywhere from just a couple of liters a minute all the way up to like 10 or 15. It's because it has a higher flow. It's much better for the patients with obstructive diseases. So we're up to 6 liters, and we're at 40%. And let's say I wanted to know how much flow that was going to give me. So 100% minus 40 over 40 minus 21 for room air. So you get 60 over 19. It's a ratio of 3 to 1-ish. So with that 3 to 1, let's say they were on 5 liters a minute. So 3 to 1, that's 4 times, let's say 5 liters a minute from the flow meter, and that will give us 20, which is not really enough for the minute ventilation. So we would need to up that flow from the flow meter. It would need to go up to probably at least 8. Yeah, 8 times 4, 16 is 32. So that would give me a flow of 32 liters a minute. So that is oxygen delivery devices and oxygen gas safety. Thank you.